Well, hello everyone. This is your lovely host of the Empower to Empower You podcast, Mrs. B. Wendy Jackson. I'm so excited to be here once again. If you've been following with the podcast, listening to the episodes from January 2020, thank you so much for those of you who have supported or rated or reviewed or shared. I have had amazing guests. I'm super excited. I get to have Melissa Armstrong back. Y'all, if you remember, Melissa was here about May. We did an episode with her. It was episode 187. We talked about my mom told me, not God told me, my mom told me God was not real. So that was a really great conversation. If you have not tuned in or listened to that, I want to almost dare you to go back and listen to it. So Melissa is here. She is a holistic wellness, a holistic health. Let me say the right way. She's a trauma-informed, holistic, all things wellness and functional nurse coach. Am I saying that right?
Yeah, trauma-informed functional health coach.
Trauma-informed functional health coach. It's a lot of letters, a lot of
Yeah.
words, but we have to put the trauma-informed in front of there. We have to.
Yeah.
We have to. I'm so glad to have Melissa back. We're going to talk a little bit about functional medicine versus traditional medicine. That is such a key topic. So let's get into it. First of all, let us talk to us about how did you get into medicine?
Yeah, so I think I always knew that I would do something in like medicine and helping people. I was almost born to be a healer. If you go back and listen to our last episode, I talk about my story and my own experience as a child and growing up in a abusive, addicted household. I knew from a really young age that I wanted to help people. And then really when my brother died when I was 18 was what kind of like catapulted me into like, okay, yes, this is exactly what I want to do. I wanted to be a nurse because the
Mm,
nurses that took care of him after his accident were angels on earth. And I wanted to help people kind of in the same way.
yeah. When you hear the words of medicine, like define or just kind of identify what's usually the goal of traditional medicine.
Yeah, that's so tricky because I feel like it used to be different and
Yes.
kind of standardized medicine and insurance, the insurance industry and the pharmaceutical industry have really like shifted what medicine is about. It's not really about the patient and the outcome and what's truly best for the patient. It's really about money
Yeah.
and getting the patient out as fast as possible because the longer that you're there, the more money it costs.
Mhm.
And yeah, so I think most of the people that work in traditional medicine, like the doctors and nurses, most of them are fantastic people. This
Yeah.
is nothing against the actual people working in those
Right.
systems. And there's so much like we need the ICUs, the ORs, the ERs, but the whole model, the whole system is really broken. And now it's just this model of like get them in, get them out. Most doctors, research shows that most doctors make a diagnosis within 7 minutes of entering the room. So
Oh,
they're really trained in medical school to make a diagnosis because once they have a diagnosis, they can get make a diagnosis so that you can fix it, and here's what fixes it, and it's usually a pill. um so that's
yeah.
kind of like that's how they're taught.
That's so sad. That is just so sad to hear because I'm sure you've heard the horror stories, you've seen it. I've heard the horror stories. I'm glad that you differentiate. It's not the professionals. I mean, yes, there are, people who are not people of integrity in every profession.
Yep.
There's bad apples, if I could say it frankly, but usually there are some amazing doctors,
Yeah.
amazing nurses, specialists who are compassionate and whose heart is for the patient, but they're in a very vicious system that is
Yeah.
not client centered or patient centered. So
Yep.
just to hear you say the research shows that you can make a diagnosis. 7 minutes is not even enough time to really practice bedside manners and get to know the person in front of you. And when somebody's talking about years or months of pain and distress that they've experienced, seven
Yeah.
minutes.
Yeah.
Wow.
Yeah.
Wow.
And that's not when you think about like all of the like chronic illness that we see in
Right.
our country, like chronic illness is on the rise, diabetes, anxiety, depression, like those things are so on the rise, at heart disease in our country. Like, how can you possibly adequately understand the full perspective of a person and their experiences and their traumas and their history and their goals and all of the intricacies that go into a person's health in such a short period of time, and adequately give them what they need? Because we know also
Right.
from research that they estimate that 95% of illnesses are either caused by or worsened by stress.
Yes.
So if you only have, less than 15 minutes with your doctor, do you think your doctor has enough time to assess you, get the full picture, and then give you like reasonable treatment options as far as like things you can do to decrease your stress, nutrition that you should focus on, those kinds of, they don't have the time. They don't
They
have the
don't.
time. So what they do is they give you a pill because that's what they
Yeah.
have time for.
Absolutely. I literally just had a client who, I mean, I was physiologically, as a therapist, I have to be very careful about how I express my emotions in reaction to what I'm hearing, right?
Mhm.
It doesn't mean I have to be stoic. There are times I'm going to cry with my client, right? Like there are times I'm going to be honest and say that is really hard to hear. But there are times I'm hearing things and I'm physiologically like I could just feel myself like getting upset about what the person is saying to me because I cannot believe that what I'm hearing. So recently, this client was experiencing just let's just say some hormonal issues, some women issues, and she was told it was recommended that she takes progesterone and then takes estrogen, and her body went into complete shock, over bleeding, you name it. And then, long story short, never got to talk to her doctor,
Mm.
kept being shoved around from one nurse practitioner to the nurse practitioner. No, the doctor never called her. And then when she goes, she waits an hour and a half. The person comes in. This is when the clinic now you have multiple clinics, right? Because they're growing so fast, but they're growing so fast in a way that's ineffective. This person walks in the room, no file in her hand, and ask her to repeat everything again, what is going on, and then says to her, "Oh, you can take Paxil and Prozac at the same time." What? Yeah. I was upset with the client. I
Yeah.
was upset with the client because it's almost like some people are put in those positions where their lives are gambled
Yeah.
because careless decisions are being made and things are being worsened, and
Yeah.
people are taking time, unfortunately, because of you have to get them in and out, decisions are not carefully made, right? And so it's just really, really sad. So let's get into what is functional medicine and what are usually the goals of functional medicine.
So, functional medicine is a root cause approach to health. So, when the philosophy behind functional medicine is that symptoms in the body are um, are messages from your body that there is some imbalance within the body, and that once you correct those imbalances, that the body will actually heal, that the symptoms will be eliminated. So different than conventional medicine, which is like treating. Conventional medicine looks at what is the diagnosis and what can we give you to stop the symptoms. Functional medicine looks at why do you have that symptom, why is your body presenting this way, and then evaluating how we can restore that balance to allow the body to do what it's naturally made by God to do, which is to heal. When you think about like cutting your hand, like when is the last time that you cut your hand and you thought about like, oh, I got to make sure I heal that cut? No, you don't do that. Your body is inherently designed by God to heal. So sometimes we just have to allow that to take place, eliminate like toxicity, improve nutrition, manage stress, get better sleep, drink water, like these things that are like so integral to health that like I feel like the general public just doesn't know. So functional medicine, the goal is always the root cause. And I kind of hate that term root cause because it makes people think that there's like one single thing. I always talk about root causes because there's typically multiple things that are causing these symptoms: inflammation, stress, lifestyle, toxicity, gut health. Those are kind of some of the big ones. So once you can identify those root causes, you can work to fix them and then eliminate the symptoms rather than having to take another pill.
So let's just kind of play this out for a second, just to make it practical for people that are listening. So when I hear you say the root causes of a disease, what does that look like? So somebody comes in and they're presenting to you, they call you, they have tried traditional medicine, they have been disappointed, they have taken medicine upon medicine and medicine for the side effects of those medicines, right? And now they are just almost hopeless, and you are the resort.
Yeah.
And so they're coming to you, they're dealing with chronic pain, they cannot sleep, they now have sleep apnea, they have diabetes, maybe a little bit of high blood pressure.
Yeah.
Walk me through about how might you address and support this? Where would you start? What would be the patient treatment plan, or I don't know if you call it treatment plan, but talk a little bit about that.
So the first step is always a super thorough, extensive intake. So most functional medicine providers, myself included, have like dozens of pages long intake paperwork. My paperwork is 38 pages. So it gives me a really clear picture of everything that the client has going on from birth and childhood through the current state, and like talks about symptoms, surgeries, traumas, dental work, diagnoses, current medications, current symptoms, all of those things. So really, like, what I do is I sit down with that intake paperwork and the information that I usually have received from a phone call with the client, with the potential client, to gathering some information about what their specific goals are. Because some people have goals of, like all of what you described. They'll come in and say, I just really want to feel better. Or some people come in with all of what you described and say, I really want to lose 50 pounds. Like, so it just really, like, where is your priority? Trying to figure out what their goals are, because that's super important. And then I literally sit down and I map it all out. Like, okay, so they've got this symptom, and what could possibly be causing that, and what evidence do I see in their body that there's some sort of like root going on. So for instance, if you say, you said chronic pain. So like, I think like joint pain, I'm always thinking like massive inflammation through their body. Like, and why is there inflammation? Sometimes inflammation, the root cause of inflammation could be a surgery, could be medications, could be childhood trauma that you didn't deal with from 40 years ago. It really just depends. So that's where it's so important to look at their paperwork and come up with like, what is the likely cause of this? And then
Mhm.
that's where you start. That's really, and
Oh,
then you start saying like, if it's inflammation and it's from a past surgery, like how can we get inflammation down in the body overall? So how do
mhm.
we get inflammation down in the body overall? Better nutrition, taking better care of yourself, movement. A lot of people think like, I have joint pain, I shouldn't move, I just don't want to move it, I don't want to bend my knee, I don't want to walk. Movement, light movement, like a movement in joints is so important.
Mhm.
Immobilizing them just only worsens the problem.
Mhm.
Inflammation can be caused by chronic stress,
Mhm.
so it's all about like stress management, lifestyle, decreasing inflammation, sometimes using supplements, or natural products like curcumin is a good natural anti-inflammatory. So really addressing that inflammation from a natural perspective, trying to get the inflammation down to see if that helps, and then see eventually if we can eliminate some of those symptoms.
Yeah, I like how when you were describing that and just kind of talking through what that would look like for the person as you're sifting through this extensive and intensive intake, you did not go straight to, okay, it's because of you eating bad. Like, and food, yeah, nutrition definitely does play a role, but a lot of times people go straight into you're eating bad, so this is why you're sick. And I love
Mm-hmm.
how you identified that, yes, that may be a factor, but let's look at other factors as well.
Mm-hmm.
Especially when you have somebody coming to you and they say, well, I want to lose weight. I've
Mm-hmm.
tried A, B, C, D, E, F, G, but nothing's working.
Mm-hmm.
And I could imagine that you have to assess, okay, what else is happening that may be preventing you from losing weight and
Mm-hmm.
identify all the factors. Is that kind of what I'm hearing?
100%. And I always like it, there's always, almost always something else with the like those women or those patient clients who say, I can't lose weight, I've tried all these things. It's almost always something else. There's usually some like chronic stress, inflammation in the body, and the inflammation in the body is complex. It's not just usually related to food. Certainly, like you said, there's certainly usually some element to that, frankly, just because our food in this country is like crap. Like we just, the food industry is here to make money, and they pump everything through it full of preservatives and chemicals and sugar, and everybody's addicted. So, but yeah, that's definitely a part of it, but it's not all of it. It doesn't give the full picture.
That's good. That's good. Do you have any testimonials, Melissa, about how functional med made a huge impact in someone's life?
Yeah, so many testimonials. There's tons on my Facebook or on my Instagram page.
Okay.
But like it's all over. Like their functional medicine is literally saving lives. And I personally, we get, like myself and a lot of my colleagues, friends that I have, we get a lot of clients who have tried traditional medicine. They have tried everything, and they are just exhausted and disappointed and disheartened, feeling like, well, I guess myself included, like I was told when I was like 20 that I was going to be on antidepressants for the rest of my life and that there was no cure for depression. And I've
Wow.
been off of medication now for over 10 years and I'm not depressed. So
Mm,
clearly that's not right.
right.
There is a
Yeah.
cure. And for me, it was about really addressing my lifestyle, really addressing my stress, healing that trauma that I was holding on to from my childhood, and
Mhm.
advocating for myself and making myself the priority, and trusting my body, really getting um, connected with my body and the sensations that I was feeling, and working to manage my thoughts and all of those things. It's a complicated process. It's not
Right.
easy, but if it was
Right.
easy, everyone would do it.
Absolutely. Any other testimonies that comes to mind? I know
I
you.
just think of like, well, right now I have one client who came to me primarily with depression and GI symptoms. It's kind of very similar to my story. Her childhood was very traumatic, although she didn't really remember some of the pieces of it. I think, there's some disconnection from the memory as her mind's effort to protect her. So she came with like lots of GI symptoms, kind of like IBS and depression. Those were her two biggest complaints. And we've been working together, I don't know, 3, maybe 4 months now. And she's my age too. She's a little bit younger than me. So she's like in her early 30s, and she had high blood pressure, was on 2 different blood pressure medications at like 30. I mean, she's early 30s, 31 maybe, off of one of her blood pressure medications, off of her antidepressants, lost unintentionally. Her goal was not to lose weight, but unintentionally, as a result of everything that we've been doing and her healing her trauma and dealing with her stress and taking better care of herself and just being aware of what she's eating, not even necessarily doing a lot to change it, just choosing better options when like she has, cake or carrots in front of her. Like, sometimes you should have cake.
Right.
She's just making better choices because she feels empowered and she feels better. She's unintentionally lost like almost 20 pounds. So she's feeling better about herself. She's feeling better in her marriage. She's feeling like she's showing up for her kids better. She's, like, and that's one of like dozens and dozens of like testimonials I personally have, but I hear all kinds of, stuff all over the internet all the time. Like functional medicine is saving lives.
That is so good. Just
Mhm.
a couple quick questions. How estimated, how long are people needing to work with a functional coach or functional doctor or nurse?
Yeah, so I think it really depends on on the specific client. So for me personally, I bio individualize every program for my clients. It really depends on exactly what's going on in their body, what labs I think that we need, what treatment I think that we need, how complex the case is. I would say typically 6 months is about where I start. Sometimes a little bit less, sometimes a little bit more. 6 months is a really good foundation to give you like a lot of what I focus on very heavily through my program and working with somebody is education. I really want to work myself out of a job. I want to educate you so much that you're like advocating for yourself. You know how to trust yourself. You know how to go into a doctor's office and say like, no, I don't want to do that. What are my other options? And really feel empowered to make the best decision for you, because only you can decide that. I don't know what's best for you. I think 6 months is a really good time frame to give you like a really solid foundation of like lifestyle things that are going to help you long-term sustain real good health and make the changes and see the results that you want. Yeah.
Yeah. So have you seen functional medicine or functional specialists, functional coaches on as part of a multidisciplinary team? So for example, that you're the functional nurse coach, but there's a therapist that you're working along with. There may be another type of specialist that you're working along with. Have you seen that to
I
address
have
all the different?
I have never seen that, but I would love to see that.
Yeah,
It would
really.
be phenomenal. It would like, what an incredible business model.
Yes,
I've
because
never personally seen that. I don't know if it exists.
interesting. Okay, I just like
It very well might. If
right,
anybody
right.
listening knows of something like that, please send me some information. I'd love
Absolutely.
to learn more about that.
Absolutely. So just let's talk really quickly about accessibility and affordability. So in terms of access, for people to access a functional medicine specialist or a coach like yourself, can you serve people who are only in your city or across the state lines, telehealth? Talk a little bit about the access. How can people access you?
Yeah. So me personally, I am as a certified health coach, I can see anybody anywhere, across state lines, other countries, anything, um, anywhere. There's no regulations on that. I do use some labs. For the
Mhm.
labs, I have a physician affiliate. So there's an actual physician. I recommend the labs, and then the physician does the ordering.
Mhm.
So yeah, I can see anybody anywhere. I do everything 100% virtually. I do have some local clients that I do sometimes have some face-to-face meetings with, just because I think that it's, some people prefer it. And sometimes just actually seeing somebody face-to-face can serve a client better. So, but mostly everything's virtual.
That's so good. That's so good. And what about affordability? So in terms of, insurance, can somebody receive services through you? Is insurance even paying for functional or covering functional medicine?
Yeah, such a good question. This one really heats me up because
I
the answer
know.
is no.
What?
Insurance, it's not that I would not accept insurance, it's that insurance does not recognize functional medicine as a medical necessity. And I
Wow.
suspect that the reason all goes back to what I said at the very beginning, which is money. Functional medicine is not a quick fix. Giving
Mm,
you a pill is a quick fix because it makes the symptoms, it dampens down the symptoms, and you can sometimes feel better pretty quickly. Um,
mm,
but insurance does not recognize functional medicine as a medical necessity. They do not reimburse for functional medicine providers. You can, the IRS just recently, the IRS is who dictates like what you can spend your HSA and FSA on. And they just at the beginning of this year said that health coaching can in fact be reimbursable through an HSA or an FSA, so long as you get your primary care doctor to refer you. So you just have to have them write a letter of medical necessity. And some HSAs and FSAs are a little bit more lenient, and they'll just actually just let you charge it. But sometimes you do require a simple letter of medical necessity, and then you can get it reimbursed from your HSA and FSA. And
that,
because functional medicine is not a quick fix and takes a really a lot of time to uncover those root causes and really work with somebody to change habits. Like habits are so hard to change.
mhm.
So really like working with somebody one-on-one over the course of a period of time, like 3, 6, 12 months, definitely is going to cost money.
Right.
Like unfortunately, I feel like I charge a really reasonable amount. Every program looks different for me, for my clients based on what they need, but I never am overcharging. And
Mhm.
I always say to people, if money is a concern, I always challenge people to consider how much not being well is costing you, because
Mhm.
not being well is also costing you something. If it's not costing you thousands of dollars out of your pocket, it's costing you years off your life. It's costing you quality of life. It's costing you being able to live your dreams.
Yes.
And it's costing, potentially if you have kids, it's costing your kids and your
Mhm.
grandkids. So
Mhm.
consider that, because being unhealthy is costly as well.
Yeah, it is definitely. So the first step to see, let's say somebody's listening and they're like, you know what, I need to consider a functional health coach. Would they need to get a referral from the PCP or can they just reach out to you
Yeah, they
directly?
can. Yep, they can just reach out to me directly.
Mhm.
And my website is HolistichealthbyMelissa.com. You can reach out to me there. There's an application to work with me. You can just fill that out, and that will trigger me to give you a call for just a free 15-minute strategy call to see even what's going on, to see if I can even help you. And if not, then I can point you in the right direction, because I have a huge network of colleagues that I work with. And then if so, then we talk about next steps. And if it's not me, there's lots of functional medicine providers all over the country, all over the world. Find somebody that you click with. Find somebody who specializes in what you're dealing with. If it's trauma, I'm a trauma that's what I do. That's my jam. I really help women heal their whole mind, body, and spirit who have gone through trauma without pills and procedures. That's my jam. But there's other providers that focus on like thyroid dysfunction. I know what the thyroid is. I've worked with many clients with thyroid stuff, but there's other providers that might be a little bit more qualified because that's what they specialize in. So whatever, find somebody that you like and interview them, because it should be a good fit for both sides, especially if you're going to be investing with somebody and working one-on-one with somebody. You really want to trust that person. You really want to understand what their philosophies are and make sure that they align with you. I think all too often right now, there's a lot of functional medicine providers, functional medicine doctors who have like brick and mortar clinics where you basically go in there and they'll charge you whatever $1,000 to do a bunch of lab work, have the first appointment, then they'll give you a list of supplements and tell you to come back in 3 months. So to me, that's a little bit more like
traditional,
leaning back more towards that traditional model where it's like, you're on your own, good luck, call us if you don't have any problems. I don't like that. I don't think that people can be successful. I don't think it's really going to give you the sustainable changes that you're wanting. So I think really do your research, interview the provider, make sure that you have all of your questions answered, and that you feel really good about it going into it, because you deserve to feel good about it and trust the provider that you're going to be working with.
Yeah, plus it's a relationship that you're establishing. So it needs to feel safe. There has to be safety there.
100%.
Is there anything else that I didn't ask that you need to share before?
I think I probably said this on the last one, but I just encourage people to remember what I said earlier about like your body is inherently designed to heal. Our bodies are miraculous. You are able to heal. And I don't care what the diagnosis is, what the circumstances, what your story is, what the experiences have been. It doesn't matter. None of it matters. Healing is always possible. Always.
Good. Well, Melissa, I really appreciate you. Thank you for your service, your compassion to help people experience healing in their bodies and in their overall well-being. This is so interesting. I'm glad I have this information that I know if I had questions, even for me personally, I can say, I know somebody and I could reach out. So thank you so much. I cannot wait for people to hear this. And reach you at HolistichealthbyMelissa.com. And your IG is Holistic Health
by Melissa.
By Melissa. Everything's Holistic Health by Melissa. So I'm going to make sure to put that in the show notes. So thank you for being here today. Again. Yes.
My pleasure.
Absolutely. Well, y'all, this is Wendy Jackson. I hope that I know that this was very, very beneficial and added so much value. Listen, just reach out to Melissa. If you're not sure, just reach out to her for a consultation call and at least continue to learn more about this. Your health deserves the best effective care. You do not need anybody to play Monopoly with your life. And so I'll be back next time with another amazing episode. And this is Wendy Jackson. Have an amazing week on purpose. Bye-bye for now.
Bye-bye.